Hi, this is Dr. Dulac coming to you from my office in Springfield, Virginia. We get a lot of questions about dental emergencies. Today, I want to go over some of those questions with you and let you know what we can do for you here at the office. Some people ask, what is a dental emergency? A dental emergency is anything that you consider to be an emergency. It could be a broken tooth, pain, sensitivity, your denture broke, toothache, you have swelling. Whatever is an emergency to you is an emergency at our office, and we want to take care of that for you. So, broken tooth, we have same-day crowns in the office. Broken denture, we've got a lab in-house, we've got a lab next door. Toothache, swelling, I do root canals, I do extractions, I do implants. If you're missing a tooth, we can replace a tooth. If you have sensitivity, some people just have bad sensitivity, and, just a topical desensitizing agent will help that. We have people who get, cold sores, blisters, canker sores, lesions of any type. Those things are really easy to fix, but I know they can be super annoying if they're on your tongue, or it's hard to swallow, or it's cosmetically concerning. It's really anything that we can help you with here at the office, which is quite a bit. When would you want to come in for emergency care versus scheduling a routine appointment or going to the emergency room or urgent care? At the emergency room or urgent care clinic, they don't have dentists generally. They're not going to do anything for you to help you. They're going to give you antibiotics and pain meds. It's a Band-Aid at best. At worst, it does nothing. If you don't have any concerns, schedule a cleaning checkup. We'll get things taken care of for you before they become a problem. If you do have a problem, give our office a call. I will do everything I can to get you in that day, even if it means going over lunch or staying late, and we will fix it because the emergency room's not going to help you out. That being said, if you have swelling that's going down your neck and impeding your airway, or if you have an allergy to something that you feel like you can't breathe, you're having a stroke, paralysis, something like that, call 911. Some people ask, what are common dental emergencies and what should I do about them? I would say call the office so that we can get a diagnosis, so we can see what's going on, so that we can properly fix it. But broken tooth, we get that a lot. Give us a call, we'll get it fixed for you. Broken denture, we get that a lot. Give us a call, we'll get it taken care of for you. Sensitivity, give us a call, we'll get it taken care of for you. That's a quick and easy fix. Sores in the mouth, give us a call, we'll get it taken care of for you. What is a wisdom tooth and what is wisdom tooth pain? Your wisdom teeth or your third molars come in usually in late teens, sometimes early 20s. They come in the back. Sometimes they're pointed forward or down or backwards, and they can't come in properly. And as they try to come in, people get a growth or eruption pain as they try to come through the gum or they hit that resistance of the other tooth. It's generally mild discomfort, but sometimes if the tooth's half in and some food or bacteria gets packed down in there, you can get an acute flare-up. That's pretty painful. Give us a call, get you on some antibiotics, get it irrigated out, get the tooth out for you as soon as possible. What causes bleeding gums? First of all, if it's been more than 6 months since you've had a cleaning, I would say a professional cleaning. No matter how well you clean your teeth every day, even with a Sonicare toothbrush, which I recommend to all my patients, I think it's the best. I use one personally. You're going to get tartar buildup on there. That's, those fuzzies you get on your teeth like your tooth's wearing a sweater. That's a layer of bacteria. That bacteria builds up on the tooth. That you can brush off. Over time, the same minerals and saliva that keep your teeth from strong and keep them from dissolving, they start to calcify that bacteria, and it just kind of builds almost like a coral reef. The outer layer is infected, active bacteria. The deeper layers are calcified. You cannot get that off with a toothbrush or floss. And over time, it will cause bleeding and inflammation in the gum, and that will then cause bone loss. That's what we're trying to prevent with cleanings. That's why we want you to come in routinely. You cannot get that off your teeth yourself. So the longer it builds up, the more it progresses. So bleeding gums could just be, hey, I got a popcorn kernel stuck in there, and it goes away on its own, and you had a cleaning a couple months ago, fine. But if it's been more than a couple months since you've had a cleaning, you could have periodontal disease or gum disease, which is a serious infection. You don't see it because it's under the gum, but if you had an infection that big on your skin, you'd be in the emergency room. So please come see us. We'll get it taken care of for you. It's a quick, easy fix. And the health benefits of that are substantial. Heart disease, cancer, strokes, diabetes, the list goes on. All the bad stuff that you don't want can be made worse by periodontal disease. If your bridge came off or your crown came off or your veneer came off, keep it, save it, give us a call. A lot of times it can be re-cemented. I know a lot of doctors at a lot of office that say, I don't re-cement crowns. Why? Because they're jerks. I mean, honestly, if there's nothing wrong with the crown and there's nothing wrong with the tooth, we'll re-cement it for you. It's cheaper, quicker, and easier than doing a new crown. If there is something wrong with it, I'll let you know and I'll go over the options with you. But this is a quick fix. Give us a call. We'll get it re-cemented for you. When do you need an emergency dental extraction? If we can't save the tooth or you don't want to save the tooth with a root canal, then I'd recommend an extraction. We do root canals at the office. We can save the tooth if you want to save the tooth, if we can. There are sometimes due to the infection or bone loss, it's just beyond what we can save. Luckily, we do that in the office. We do implants in the office. We will get your tooth back for you. It takes a little time and a little healing. It's got to be healthy, but that's something we can do for you and we can fix for you. And I'll go over all those options if you have a broken tooth. Why might you need an emergency root canal? When a cavity or decay or bacteria gets into the nerve or pulp, every tooth inside of it, it has a blood vessel and a nerve. When something gets into that and that gets inflamed or infected, it causes a lot of pain. So if you're in pain, acute pain, you usually have something that's gotten into the nerve. And when it gets to the nerve, you can either do a root canal or you can take the tooth out. Most of my patients like to save the tooth. We can save the tooth for you. Root canal is a quick, easy, painless procedure. The number one thing I hear about root canals is, oh, that wasn't as bad as I thought it would be. So they get a bad rep because of, 20, 30 years ago, it took a long time. They didn't have rotary instrumentation. People were so infected, they couldn't get numb. There are so many ways now to do that painlessly and effectively and efficiently. Even assistants I've had work for me say, you've changed my whole mind on root canals. It should be quick. It should be painless. I will never work on you in my office if you're not numb. So I will get you numb. There's a lot of ways to do it. There's hundreds of ways now. I mean, there's different injection techniques. There's intraosseous injections. We have sedation. We have nitrous. There's so many options. If you're worried about pain, I promise you I will not work on you if you're not numb. Do we offer same-day care? Yes, absolutely. If in any way possible, I can see you that day. If you have an emergency or you're in pain, we will do that. One of the things we have at my office is a same-day crown machine, so you can get the same high-quality ceramic crown that you can get from the lab in one visit, no temp, no return visits. Your temp's not going to come off. You don't have to make a separate trip to the office. It is the same high-quality ceramic that you're going to get from the lab, and you're going to get it that day. Only about 15% of dentists in the United States have that. We have that. It's one of the main reasons my patients come to my office and refer other patients to my office. What do you do if you have an emergency after hours or on the weekends? At my office, my cell phone, my personal cell phone plays on the recorder if the office is closed. So you'll always have access to me. It's my regular cell phone. You can text me at that number. You can call me at that number. We can do a FaceTime. You can text me a photo. So in this day and age, there's a lot of ways to connect with people. I can call in medications anywhere in the United States. If you're out of town, not if you're out of the country, but if you're out of town, if you're here in the US, just give me a call. We'll get it taken care of for you. I hope I've answered some of your questions on dental emergencies. Every case is different. Give us a call at the office, 703-451-4500. We get texts at that number as well. Same number. You can text it. You can call it. Give us a call. One of my front desk staff will get you taken care of and get you in to see me, and we'll help you out.